Hello and welcome everyone. Come on in. We know it's going to take a few seconds here to make space for everyone. As you're sort of joining, feel free. We really do try to create a sense of community here and would really appreciate just sharing your name and where you're from. You could pop that right into the chat box so that our speakers have a sense of where everybody's coming from and who's joining us. So far, I'm not seeing very many from the East Coast where we're all from. We're all struggling with a little significant weather here. Terrific, welcome. All right, I'm just going to give it another second or two. All right. Well, welcome. Happy New Year. We are so excited to sort of launch this first of 2020-24 Early Efforts webinar. We've got an amazing dynamic panel and really looking forward to the opportunity, not only for you to kind of hear and learn, but also to have an opportunity to pose some questions and try and create some conversation and discussion among the group. To start, I just want to introduce myself. My name is Ann Henschel. I am the Director of Early Learning here at the Hunt Institute. For those of you that aren't familiar with the Hunt Institute, it was created and founded by four-term Governor Hunt here in North Carolina. We're based in Cary, North Carolina, thus the reference to the east and some challenging weather that hopefully will not impact our opportunity to chat. Again, as those of you are joining or sort of sharing where you're from, I'll just say a little bit about the Hunt Institute for those that are brand new. The Hunt Institute is really designed as a support around education for all of our governors and elected officials across the nation. And specifically here for this webinar, we're focusing on those early years, though the Hunt Institute looks at education from the full continuum. So again, appreciate you joining us for today. I'm going to share just a little bit of housekeeping information before we get started. I'm sorry, I want to acknowledge our presenters who have joined us. So we have Dr. Catherine Ann Edwards from as an economist from Bloomberg. We're also pleased to welcome Michelle Kang, CEO of the National Association for Education. And then we also have from New Mexico, Angela Garcia, who is CEO and owner of the Toy Box Early Learning and Childcare Program. Though I will sort of full disclosure say that in addition to that, she's played, as you'll hear, a significant role in partnering with her state legislator and sort of helping move some of the exciting work happening in New Mexico. So a few more housekeeping items to kind of remind you, we do have closed captioning down at the toolbar, and also there's a Q&A box there. That's where we really encourage you as you're listening to sort of share your questions, and we will allow some time at the end for a bit of that Q&A. And it's also just easier for us, obviously, to find those questions versus, as you can see, our chat box is quickly filling. So again, just a few housekeeping details, and I'm anxious to sort of get the conversation started and to be able to hear from each of you. So I'm going to start with you, Catherine, and just ask, can you just share a little bit about, as we're thinking about the current state of childcare in this country, and knowing that what we had referred to as that foreboding cliff that we were anticipating, because across the country we had some federal support during the pandemic period. Now here we are, it's 2024, the cliff has happened, and so kind of wanting to think about what the status and where we sit. And so from your perspective as an economist, and just so thrilled to have you be a part of this conversation, can you help us just sort of set the stage on kind of what we're hearing? We often hear childcare referred to as this sort of broken market. What exactly does that mean in practice? And are there any implications that should be considered related to public policy?
Sure. Well, first, thank you for having me. Like Anne said, I'm a PhD labor economist, and I'm very excited to be here and talk to y'all. When we talk about childcare, you really can't say it kind of in the world of economics without noting that the private provision of childcare is a market failure. And what that means is that it is insufficiently supplied, and the supply that we do have doesn't meet the demand for people who want, to put their kid in care, and the price at the supply that is currently offered is out of reach for a lot of families, right? Which is something that anyone who has worked in or experienced childcare knows. It has nothing really to do with like the motivations, the qualifications, the intent of private childcare providers. It's that you can't get to the math to work. It's not profitable or cheap to look after children. The other aspect of childcare as a market failure is that there's no market solution coming, right? When we think about, a market good or a market service, this is a type of good that could be, say, radically improved if there was some type of technological advancement, some type of efficiency or scale that will improve the delivery of the goods so that it can be supplied more at a lower price. None of that is coming for childcare. Little tiny people need the eyes, the hands, the attention of a capable and careful adult. And there's no making that cheaper. There's no technology, there's no scale. You have to have an adult to a small number of children when those children are small. So this market that we have is basically in a slow decline because this is an unsustainable privately supplied good, at least, and that it's, out of reach for many families. What I tell people is that, one evidence of this market failure is that over the past 30 years, the cost of childcare has increased more than housing, more than food, more than energy, more than medical care. It's even increased more than prescription drugs. This is one of the fastest rising costs in the bundle of things that families consume, and it's not going to turn around. It has no ability to turn itself around. And again, that says nothing about providers. It's just about the good or the service being supplied. The public policy implications of that, of any market failure really depend on what the good or service is being supplied. In the case of childcare, we know from research and then also just basic intuition that it is important for society to have reasonably good care of young children. It enables parents to work if they want to work. It's an investment into the education of that child that can have enormous dividends in the future, and relieving families of the burden of having to pay this kind of amazing cost for childcare. It radically alters kind of family purchasing power and income. If childcare is running at $24,000 a year, it makes a big difference for family if that's just taken off their books. So, these two things or three things combined, right? It's currently a market failure. There's not a private solution coming, but there are massive public gains to having adequately supplied and priced childcare. Makes this a public policy question, or, as I like to say, really makes it a question is why public policy has not done more. You are still muted, Anne.
That's what I get for muting myself. That's such a powerful perspective, and especially from an economist. Thank you so much, Catherine. I'm going to circle back to you in a moment, but I'd like to hear from Michelle as sort of the leader of the professional association for those working in this sector. And so, Michelle, can you just share a bit about sort of the work that's been happening there at NAYC, surveying the sort of childcare funding cliff, that, as you know, as the title of this webinar stated, we've now officially gone over that cliff, and that COVID funding relief has expired. So what's your sense of the current state of the early childhood industry, and how is the absence of this federal funding impacting programs and parents? What are you hearing? What's the information you have?
Right. Thanks so much, Anne and Catherine, for that clear explanation of the core issues in early childhood that long predate this pandemic. And let me also start by saying that even though we're all talking about the cliff as though it's something we all tumble off of at the same time, the reality is that different providers in different states are sort of going off the cliff at different times. And it's really important and also really complex to both understand and explain this reality as it's being lived. So throughout the pandemic, as you shared, and NACI has been working tirelessly to lift up the lived experiences of early educators and to ensure that policymakers understand the needs of the sector. One of the ways that we've done this has been through our surveys of the field, and I'll talk about those more in a moment. But combined with our intensive engagement with early childhood educators who generously share their stories and their expertise with us, like Angela is going to share with us shortly, we've really been able to understand and in turn share those experiences with policymakers. So remembering back during the early years of the pandemic, our policy leaders were actually incredibly responsive to the needs of the field, recognizing that early childhood educators were essential to the communities they served, and invested nearly $50 billion in federal relief to support providers in staying open, supporting the compensation and well-being of their staff and families, and also continuing to provide high-quality care. However, it's important to be clear that that responsiveness has waned in recent years, which culminated in the expiration of the Child Care Stabilization Funding at the end of September 2023 that had been instrumental in sustaining the quality, the supply of quality care and keeping providers open. And it wasn't as if this cliff came out of nowhere. Providers have been raising these alarm bells that absent new federal funding, they would have to raise high tuition rates on families, reduce staff wages and benefits, and in some cases, close altogether. And unfortunately, what we have heard and what we are seeing is that these educators' predictions are playing out real time across the country, and especially in states and communities that have not made additional investments in early childhood education with wage increases or additional stabilization funds or increases to subsidy payment and reimbursement rates. So late last year, we began partnering with the Rapid Early Childhood Survey out of Stanford to track the impact of the expiration of child care stabilization funding on a regular basis. And the results, while upsetting, should not be surprising to anyone who has been paying attention to the field in recent years. Among other findings, we learned that in October of last year, following the expiration of the stabilization funding, 29% of families reported a childcare tuition increase. 28% of providers who had run out of funding had to cut wages or were unable to sustain salary increases. And 24% of those who had run out of funding were serving fewer children. And just yesterday, we put out a new field survey out so that we can continue to get additional depth on the up-to-moment situations on the ground specific to state and local context, because we anticipate these problems growing in the months to come, absent much needed federal action to ensure that some programs in some communities and children and families and educators aren't being left behind based on where they live, what their political climate is like, and what setting and funding stream they rely on.
That's stunning, isn't it? So I guess, can I just turn it over to both of you, and just, do you have a sense of the current spirit of Congress in Congress with regards to childcare? Is there any reason to think there may be hope on the horizon in terms of expanded funding? Or do we really need to start thinking about this as an issue that's kind of left to the states, given the current divisions at the federal level? I don't know, Catherine, do you want to share a little bit? I know you testified to a couple of congressional committees in recent months. What's your sense of where they are in this particular moment?
Well, with the caveat that I do economics because I really don't do politics that well, I testified twice, once in front of the Senate and once in front of the Joint Economic Committee. One was about childcare, one was about demographics in the US, in which childcare came up. And I think, all right, I don't want to sound negative. I'm not a naturally cynical person. But I don't think children and moms really sway the hearts and minds of Congress. I don't really see any kind of natural sympathy there. I'm a labor economist. I argued very forcefully that, you know, even if you don't like women or their children, this is a very smart labor force participation policy, one that the US should have had in place for decades. And that if the US is in need of workers, this is a very easy place to find them, one that we know would increase the labor force participation rate of women by probably 3 to 5 points. You know, the other argument I made is that childcare is often listed as the #1 cost facing parents, and when they answer in surveys that they do not plan on having additional children. The US is in the middle of a sustained 15-year decline in fertility. This is the opposite of the baby boom. It is anomalous how few children women are having and how incredibly consistent they are in saying that the biggest reason is cost. So I tried to present this to Congress to say, you know, you have problems. This A lot of the solutions sit like at the nexus of a lot of these solutions is childcare, is changing the way that the US basically treats children's early childhood education in a way that could affect both their parents and their ability to have more children. And I think that those arguments resonated, frankly, more than this would be good for kids, right? Just kind of this like clear what you kind of joke in the economics profession. I don't know if there's any Friday Night Lights fans in the crowd, but it's like clear eyes, cold hearts can't lose. That look, it's not about women and children. It's about raw numbers. We just need more workers and we need more babies, and like childcare is the way that you can get both. That argument actually had some salience. I had a lot of people tell me that they thought it was really interesting, and that and to wrap up, in my experience or in my understanding of other countries that have pursued childcare, they were often motivated more by the fertility rate than they were for the need for, you know, kind of wanting to invest in children. It was much more motivated to hopefully get kind of birth rates back up as countries who were industrialized entered a birth dearth.
Interesting, and an interesting sort of new lens to sort of think. I'm not sure that it's new, but powerful data again and perspective. Michelle, anything you want to build upon or add to that part of the conversation?
Thanks, Anne. Well, first, I do want to say that we are seeing shifts in how childcare is discussed and prioritized. And I see that as a testament to the incredible work of advocates, educators, parents, and allies who have been relentless, not only in the past several years, but building off of the work of the past several decades in telling their stories and sharing their experiences and expertise. And honestly, we are going to keep building off of these shifts as we all are collectively doing this work together in Washington, in state capitals, everywhere, working with our allies and partners to build on that power that we see each and every day. So of course, when it comes back to Washington, winning elements of the messaging battles is not the same as winning the actual financial and supportive resources that we need, even though it can be a step in the right direction. It's honestly not in my nature to abandon hope. I try as much as possible to think optimistically about what is possible, because we have seen what is possible when we bring together the stories and the people together to share those stories and to be at the table. However, I am at the same time a realist, and the reality is that for right now, there doesn't seem to be a lot of clear reason for optimism on the question of those substantial childcare funding resources coming out of Washington. As I mentioned earlier, Congress had the information it needed to avert the childcare cliff last year and unfortunately failed to do so. And current budget debates over top line spending aren't compatible with the bold and urgent action that we need for this sector, and we need for families, and we need for children. That said, I do want to emphasize that we have a lot of incredible champions in Congress and in this administration who are doing everything they can to put needed resources into our early childhood education systems. The administration proposed and prioritized the inclusion of $16 billion in emergency child care stabilization funding in their domestic supplemental budget requests. That was a big deal and a big change from the kind of attention that childcare and early learning has gotten in years past. And in another example, Senators Murray and Collins have put out a bipartisan proposal that would increase the resources available to childcare, Head Start, and other key early learning programs, even in this constrained budget environment. So if and when Congress is able to coalesce around a fiscal year 24 funding deal, we know that we have leaders who care deeply about early educators and the children and families that they serve. And it remains critically important, even in a challenging environment, for us and our partners to continue to support early educators and families in lifting up their stories to the policymakers who are making key decisions about their lives. And that's something we'll be continuing to do for now and always.
And if I could add just one final thought, I will say that when I've heard objections to childcare from members of Congress, it is almost always related to cost. And it's not kind of that like Nixon era veto of like, what will this do to children and families? I don't hear that anymore. I think most people now have consensus of just the value of high quality early childhood education in the labor force participation of parents. It's really comes down to cost. And I think it's just a matter of successfully messaging, sure, if you think the federal government has sticker shock, imagine how families feel. And really driving home to them, if you think the federal government would have a hard time affording childcare, now you know how so many million Americans feel when they get their first bill.
Well, sort of building on that, and I do want to get to Angela. I think, Angela's is sort of the good news of this webinar. So we're going to get there in a moment, Angela. If you don't mind, I just have one more. Somebody just posed a question, kind of building on what you were just saying, Catherine, about. So what do you think if parents were paid to stay home with their children? Would that be a preferred sort of short-term option?
Okay, real talk. I would say two things. The labor market is very mean to people who have a period without work. And so while people who want to stay home with their children, you should be able to do in America whatever you want to do, which you think is best for your child. That is the best choice, is what is best for your family. But that cost isn't just the time out of work. It's the lifetime of labor market penalties that those women will face when they go back in. And any policy that wants to encourage women or help women stay home should be coupled with some labor market regulations and reform that doesn't lead them to a permanently lower lifetime earnings because they stayed home with their baby. But that is the reality now. And so I don't think that we should talk as if it's only a point in time income that's at stake. It is a lifetime worth of income that's at stake. The labor market can be rather unforgiving, and especially to new moms. The second thing that I would say is that, in the past, in terms of policy discussions, the biggest objection to helping women stay at home is that some of them aren't married. And we just, as a country, do not have a history of being generous and giving cash to women who don't have husbands. And that is the reality. And you have to be comfortable with welfare, with having women who don't have a job and don't have a husband staying home with their kids. The US really has not in the past, especially if those women are low income, or come from low income families. So I think, for my part, I always trust families. They make the best choices. And my questions are always is how is the economy and public policy failing or helping them? If this is a choice that we want to have be more of a possibility for families and one supported by public policy, it's worth remembering which families may get the most support and who would be uncomfortable with that.
Okay, thank you. Thank you for sharing that perspective. And I just want to invite everyone not to go ahead and start populating. I see a handful of questions so far in the Q&A box, but if there are any others, I'm going to sort of move us now over to Angela. And we're, again, this is really trying to create a real conversation and synergy between what we've just heard from Catherine and Michelle, and now bringing Angela in, and then we'll sort of sort of pull together as a whole panel to sort of have some final thoughts and respond to a few of your questions. But Angela, like I said, I think your story has a little bit more optimism, but as a childcare business owner in New Mexico, is it fair to say you're experiencing the impact of this federal conversation, as well as sort of acknowledging that there have been some innovations there in New Mexico that have been put in place in recent years? I want to just acknowledge New Mexico, for those of you that aren't aware, got a lot of attention for its constitutional amendment in November of 2022, which enshrined significant early childhood funding for the state. But the constitutional amendment is also kind of the tip of the iceberg when it comes to what's happening in New Mexico. So just share a little bit with us about what the state has done in early childhood in recent years, and kind of importantly, what differences are you seeing as a childcare business owner?
All right, thank you so much, Miss Ann. No, so here in New Mexico, I have a very different outlook on things than I have been able to see on different federal levels or in other states. So I have the opportunity to discuss as a business owner with other business owners in other states, other advocates in other states quite often. And although we are experiencing some difficulty, and I only say some because compared to others, it is not nearly as much. So New Mexico has created I honestly think that we find ourselves in this position because of advocacy, education, and partnership. So many advocates, before even I got involved in any of this, have been advocating for a really long time to create a government level department here in the state of New Mexico. And I truly believe that it couldn't have come at a better time. So that passed in 2019 and was actually, the Early Childhood Education and Care Department was open and established in 2020. The governor appointed a secretary that was put into place to represent prenatal to 5 in the state of New Mexico. Right when that happened, obviously the pandemic hit. And as Michelle mentioned earlier, the entire nation began to recognize the importance of childcare and the essential need to the economy and the impact that we have in that way. I do not believe without this representation in our department that we would be able to have made so many significant changes that have allowed us to not be as impacted as many other states are with this cliff that we're talking about after ARPA funds or, and other stabilization funds that were given during the pandemic time. So we find ourselves here in New Mexico with a unique position. So we are still experiencing different issues, of course, but funding has not been as a significant issue in New Mexico as it has been in other states. And I think Dr. Edwards said it earlier that funding is the biggest issue. Anytime you talk to any lawmaker, whether that be at the federal or the state level, the sticker shock of how much this cost is astounding. Most people don't even understand how to wrap their head around the cost of quality care and increasing childcare access. But the truth is, this has been an underfunded industry for decades. So the sticker shock it shouldn't be surprising. When we don't invest in something for that long, it takes a lot to start, turning the corner. And New Mexico decided to do that. There was 2 different major changes in funding in early childhood in New Mexico. One, Ms. Ann mentioned, was that we had a change in our constitutional amendment that allowed for early childhood to have access to our land grant money. That's huge. That has been in the works for decades, and it couldn't have come at a better time. Not only did we establish that, we also created a early childhood trust fund So we had bipartisan support in our House and in our Senate in 2021 that allowed us to earmark $300 million that would be put into a trust fund that would start funding prenatal to 5, our early childhood education and care department. That has made a huge impact into our annual budgets, the available funding that we've had access to in the last 2 years. I think that those two funding moves, and I acknowledge that everything we've done in New Mexico is not possible in every state. It may not even be the solution in every state, but it does show that there are solutions that could be had, out of the box solutions, because I tell you, until Representative Gallegos came to us and said, hey, what about this? We would have never, ever thought of a trust fund, ever. But it got bipartisan support because we had the money at that time to invest. And I think that both Michelle and Catherine, they said it, everyone now understands how important early childhood is. We know why childcare is important, access and affordability and quality. We finally have that conversation has, I think, grown to a very understood place amongst lawmakers, amongst everyone in the nation. But now it's funding it. How are we going to fund it? How, and Dr. Edwards mentioned earlier, it has to come from a public place. Our families cannot afford it. The market value just cannot meet the cost of care. Here in New Mexico, we are one of the only states now that are using a cost model. We are no longer using a market model to establish our child care subsidy contracts, how much we get paid, because we all know that what families can afford is not what it costs to provide childcare and quality. And so again, there's a lot of innovative things that New Mexico has done that it has eased the cliff. We aren't feeling like a lot of states are. And it's very hard to watch other states struggling so badly because they don't have the opportunities that we here in New Mexico have. So I definitely have been, reaching out to other states to advocate, to talk about, possible solutions to help support, because I think we definitely have a long way to go here in New Mexico still. We're not there, but I think it is a shining example of what advocacy, education, partnership, because that is the one thing I think that changed a lot is people like me that were running centers in the lower part of New Mexico and southern New Mexico. We now have a huge seat at the table. They come to us, they talk to us, they try to understand us, they try to invest in us and our families. And I think that has been a huge change that you don't see across the nation. So I was thankful to be a part of this conversation, because it is so important of a conversation, because as Michelle mentioned, it's already started. We're not talking about something that's in the future. We're not talking about something to come. We are talking about something that is happening and now, and it's affecting programs now. It is affecting families now, and so I definitely am thankful to have been invited to the conversation and to share some of the innovative things that, we've been able to accomplish here in New Mexico with partnerships with our governor, with our cabinet secretary, Gerginski, and many other legislators that have truly impacted the changes we've seen here in New Mexico.
I want to sort of something you said that I thought was really important, and again, I think Michelle has the picture from the sort of from the field. In some ways, for those of us that have been in early childhood for decades, in a strange sort of way, it is kind of a time of reckoning, like our time has come. People are sort of acknowledging sort of the critical work. I thought one thing that Angela just said that caught my ear was, as an owner of a childcare program, as an early childhood educator, we would have never dreamt to sort of ask for that kind of funding, right? Like, we're so used to coming from that place of scarcity. And so I guess I've got there's a couple of questions that the group has offered I want to get to, but I want to go back, Angela, just if there are probably some policymakers out there right now, what message would you want a policymaker in another state to sort of be mindful of or thinking of based on your story and sort of the experience that you had? I appreciate what you say that, you know, not all states are New Mexico and can do what you did, but any sort of key message that you would like to sort of convey?
I think for other advocates that are program providers like myself, I think even the little things make a difference. Because I would have never, ever imagined that I would be a part of any of these conversations. But I also believe that that is where it all starts. You know, we have amazing people like Dr. Edwards and Ms. King that are out there really doing this work at a policy level for us. You know, they are really advocating for us. But I want to emphasize us. You know, because at the end of the day, when I talk to legislators, or when I have the opportunity to go to DC, or when I have the opportunity to, I work with my families every single day. You know, I have 300 families, and I could tell you every single mama, every single daddy. I can tell you all the kiddos. I can, because this is what I love. This is what I do. This is what, you know, and so I think it's important for us, even though it is not always possible to be a part of these conversations, there's many ways you can influence these type of conversations. And so, you know, finding whatever capacity you have to have conversations like this is truly important. And so you may think it's little, but I tell you, that's where I've seen the most impact, is when it becomes real. It becomes very real to legislators. It becomes very real to policymakers. It becomes very real to everyone when families are at the table, when providers and educators are at the table. So that would be my biggest thing to everyone, is that, you know, just keep trying.
Yeah, well, there's nobody's ready to give up yet, and you can see that by the comments and the enthusiasm of the participants that are joining us today. There is a clarifying question that somebody had for you, Angela. Just real quick, can you just sort of, you know, in a sentence or two, explain a little bit more about New Mexico's expanded funding and how it's being used? Is any of it going directly to families, or is it all sort of running through the state?
Okay, so it all does run through our department. However, our new department has it oversees everything prenatal to 5. So it goes childcare, it goes early intervention services, it goes home visiting, it goes, you know, so it does go to families through different programs through our department. So anything that has to do with prenatal to 5 is now under this one department. We do still have, you know, public pre-K. We do still obviously have programs through DOH, but that funding still has to come through the department and go to those other departments. So everything now is within one department, which has made it a lot easier to understand all the resources in New Mexico and fund them appropriately.
Perfect. Thank you for that. So a couple more, you know, some of us take for granted some of the terminology. And so one of the questions is just share the difference between this idea of, and I don't know, Catherine or Michelle, if one of you want to take this one, the difference between the cost model versus what the state model typically is for early childhood. So I think what Angela was referencing was kind of full cost of care versus the traditional market rate. I don't know, Catherine, are you?
Right, I mean, this is a nuts and bolts question. You know, should your state government or the federal government decide that it wants to actively intervene in the childcare market, does it do so on basically like the buyer side, where it gives people money directly to purchase their childcare, and the market still kind of produces it, but by by helping the buyers, you're basically helping the sellers, versus, are you kind of doing almost like a childcare providers basically bill the states for the cost of the services that they're providing. So most policies have an intervention on both sides, but you tend to have some type of like preference over a subsidy model, which would be like an expansion of the types of subsidies that we have now, versus like a provider subsidy model where you're almost like making them into public providers by changing how they're basically changing where their income comes from.
Thank you. Perfect. And I think that's really important for everyone to sort of understand the sort of difference between those two. Michelle, can you kind of share, do you know if we have an understanding of what the drivers of, we are hearing that some programs are increasing their costs sort of since the pandemic, that there's a sort of, what is driving the increased cost of childcare in these recent years?
Well, and before we go there, if I could piggyback on Catherine's answer, that I just have to emphasize that moving to cost of care is hugely important, and it needs to take into account compensation, not current compensation, but what compensation should be. But the market just simply can't capture the full cost of care, and as to go back to what Catherine shared, like the broken model that we have here. And that's where we see, frankly, educators subsidizing the cost of care with their low wages. And so it again goes back to what we started this conversation with, is this broken model.
Yes. Plus one, Michelle, cost of care is better. I think it's harder for the government in a lot of ways. It's not just like, and here's a check and I'm done. Like they have to, it's a little bit more, implementation matters. But it's I think probably a better result. And so that cost of care is, I think, the preferred model over just subsidizing buyers, because it changes the production of the care. And I think that's what a lot of people would say needs to happen, especially with low wages in the industry.
Agreed. And I'll just share from my years as a practitioner and director of child care programs myself, parents would always want to be on the board of directors because they wanted to understand, why is tuition so incredibly high? Like we want to be able to see the budget and understand, where is all this money going? And we're shocked to really actually see that there's very little that's actually going into the pockets of the person that's caring for their infant or their toddler or their preschooler. So it's so important for us to be able to really start articulating, when we, just not like when we're saying, what do we mean by a full cost of care, like kind of articulating that in a way that everybody can really capture and understand why it's so critical. So thank you both for that. Did you want to do the question that I posed, or I've got another one? There's questions are suddenly flying in for us. So
right, yeah. I mean, and I just would say, I can emphasize that when you think about that question, so many parents say, like, why does it cost so much, and why are educators and programs have so little, and educators making so little? When you think about going back to the science of early learning, 90% of the brain development happens between the ages of 0 and 5, and what is needed to support the development and the education and care of young minds are these ratios of what we know is best of low adult to child ratios. We simply cannot do the best by children and by families without acknowledging that in providing high quality early learning, it has a low adult to child ratio. The model simply doesn't work when you look at what parents can afford to pay, which is they can't afford to pay anymore. And as I mentioned earlier, our surveys have shown that providers don't want to be increasing tuitions and cost to parents, but they have no choice at this point without the costs, without the additional funds that they had received over the last several years, which frankly kept their doors open. And the wage supplements that they provided to keep providers in seat and to have educators having wages that were living wages is no longer possible without this additional support. So the model doesn't work, which is the whole crux of what we've been talking about today. Parents can't afford to pay more. Educators can't be paid any less. We need to have some sort of long-term sustained federal investment to support early learning and early care and education the way that it should be for our country and for our communities to thrive.
Can I also just add that I think market value versus cost of care is also a huge equity issue. because when you're talking about market value, that's going to be, what families can afford. Everybody talks about what families can afford, right? But that creates a huge discrepancy between communities. One community's market rate is going to be significantly different than another community's. So now what does that mean? That community that has a lower market rate doesn't deserve as high quality for their children or access for their children. And that's one of the biggest things that I've seen a positive impact when they're talking about cost of care rather than, a market value, because my costs don't change as a business owner to provide that care. If I'm going to provide quality, nationally accredited, a program, it's going to cost me a lot of money. But I can't do that in a community if we're going on market value, in a community that cannot afford that. So again, we're talking about a lot of equity issues being around market versus, cost of care as well.
Yeah, such a powerful conversation. There's another question that's just come in, and it's one that I've heard over the years quite often, and it's really true. The federal government does have a really phenomenal, effective, evidence-based example of quality childcare, and that's what is being offered to military families. Any thoughts on kind of what's preventing that model from becoming the norm for all our families? And I'm going to just say, so pose that sort of for the group. And I do want to also, there's a second question, which is about did New Mexico's work, was it bipartisan? So I just want us to keep kind of going back and forth between sort of federal and what federal model, but also kind of really being mindful of all the states around the country that are listening to this and trying to figure out, how if they have to work through the state, and New Mexico is an example. But let's go ahead. Anyone want to respond to that, the federal model piece? Catherine?
Oh no, Michelle's ready.
Oh, Michelle, go, Michelle.
I'll jump in, and I'm sure Catherine can add. First, let me say it's a great question, and military childcare is an example of high quality, wonderful programming. And I think it's important to continue making sure that people know about what the military does, how it funds childcare, and what it's like to be on the part of it on the educator side and on the family side, because it is a program that has supports for educators, a program that supports families and children. But to be honest, I think some of it gets back to this question of deservingness. I'll tell you a story, and I'm going to paraphrase. I was meeting with a policymaker and brought up the military example, and the person said to me, well, if you serve in the military, then you deserve quality care, but I'm not going to be responsible for making sure that anyone and everyone gets the same treatment. It is a high quality program. Everyone should know about it. And, I'd love to hear, Catherine, you might have something else, in perspective to add too.
I will say it has like a really kind of colorful history of the lack of childcare on military bases and what that resulted in, of you go out on parade at 3 a.m. and people are carrying their toddlers with them because they can't they can't leave their kids home alone even on base. So they're it was a problem that was communicated from the military families straight to command, that I am going to leave if I can't find someone to look after my kid when you want me to do something. They had one employer that they were able to do it. Now, it was not, if you read histories of it, it was not easy. It took them a long time to get right. And they had the type of flexibility within the Military Child Care Act to basically revise and reform their methods as they went, type of things that we can learn from. But the biggest lesson that we can take from the military's kind of incredible childcare system is that when there's a will, there's a way. There's nothing stopping the U.S. from having universal high-quality childcare, except for that Congress hasn't voted for it. That is the only obstacle it really faces. There's no logistical hurdle that we couldn't overcome if we actually wanted it. And I think that the military shows that lesson very, very well. It's arguably harder to provide childcare on military bases than it would be for a workplace that typically works 9 to 5, right? And so you take that one setting kind of a closed environment, and they were able to do it. It shows you what you can accomplish should you try, and there's no impossibility to the task at hand. There's just a reluctance to help, certain people, and that's hard, but it's good to know. It's
Well,
good to know.
let's keep going with that, because another question just came. So how about the CHIPS Act, right? So and now requiring manufacturers seeking federal grant funds to create microchips that they need to be able to provide childcare. So sort of building on what we were just talking about, the military model, now the CHIPS Act, thoughts, Catherine, about sort of opportunities there.
Yes, so one of the requirements for the CHIPS Act was that should you get a large enough amount of money, you have to provide childcare on site as a way to kind of invest and maintain a diverse workforce and allowing women to have access to these jobs that they might not otherwise have. It's worth noting that the National Association of Manufacturers supported this move, and several manufacturers within NAM, as it's called, have had like 24-hour childcare facilities in their manufacturing plants since like the early 90s. Because for and I think it's worth noting, manufacturers don't work normal schedules, right? They can have concurrent shifts happening or overlapping shifts going to 24 hours a day. So they're also a type of production in terms of a private sector good, where if enough people are gone, the entire plant has to shut down, right? You literally can't open if there aren't enough people on the line. And so having kind of people in their positions is vitally important. This is the type of production that lends itself to needing to have kind of employer provided childcare, because I want to make clear that employer provided childcare doesn't necessarily make sense for all employers, but in a lot of ways it makes sense for manufacturers because of the nature of their work. And so the CHIPS Act was basically requiring, if you have enough people, you have to make sure that they have childcare, because it'll change who can get access to these jobs. And we're basically paying you to make really good, high quality jobs, and we want all people to have access to them, including mothers and parents with young children. I think it's a great first step. What I wish, my kind of like preferred dream outcome from the CHIPS Act, is that you would see more employers advocating on behalf of childcare than you see now. I mean, you hear a lot from families, you hear a lot from providers, but I would hope that over the past couple of years and through examples like CHIPS, that you would hear more from employers that this is important and they can't afford it.
So that is something that we have seen in New Mexico, is a huge voice from our businesses. So we have been able to have all the chambers of commerce, they have been a huge part of our conversations because they understand that. So we have an advisory council to our early childhood education and care department. There's an advisory council of appointed members from across the state from different capacities. And the vice chair of that council is the president of the state chambers of commerce, because New Mexico has truly recognized what Dr. Edwards just mentioned, is that this is an economic problem that affects businesses as well. And they understand the impact that we're having when we make these investments.
I'm just going to jump in here to add too, because this is actually how I came to an understanding of the importance of early childhood to all of our communities, is seeing it through the lens of how employers can potentially be a solution. I mean, I think there's been some question too, if there's a contributor to the challenges being faced by the industry. And, I want to highlight, I think that it's both. I mean, there's this possibility of how childcare, especially offered by employers and connected, can be offered in the context of a larger community. It can be this much needed solution for employees who can access care for their families, especially if it goes broader than just those who work at a corporate office, if they're available to all workers at all levels, and even better, if they can be offered to members of the community at large. And there's been some great long-term examples of how this can work and how it benefits employers of all different types, as well as benefiting those with families and children. I think it's important to name that it can also be a contributor to challenges being faced in our communities if they contribute to inequitable access. For example, as I mentioned, if they are only available to certain parts of an employee workforce. And so in the broader context, like it is something that can contribute to this idea that childcare is an individual problem with individual solutions that are tied to a parent's participation in the workforce. Childcare and early learning, it's a public good. ECE in early childhood is a workforce support and also support for child development and learning. And employers can be part of the solution in the shared context. And it can also be dangerous if we're not also thinking about the broader understanding of the importance of childcare and early learning and how it supports communities and all the things that we've raised today in the conversation.
I also wouldn't be me if I didn't throw this in there, but when we're having these conversations, I think it's absolutely critical that we continue to keep family choice ahead of everything, because a mixed delivery model is absolutely crucial to any successful move in universal care. Because even if that factory chose, or was required to have an on-site facility, families might not want their children to go to that type of program. So creating a mixed delivery model that allows a really robust, family care, home providers, or, faith-based providers, or, just making sure that we're keeping in mind that family choice is truly important when we're creating access.
And you're getting lots of thumbs up and hoorays from the participants. I think that was, as time is wrapping up, I think that was a perfect sort of final word from you, Angela, of keeping it at the forefront of the needs of families, which is, I don't think anyone on this panel would disagree. And I really appreciate you sort of raising that and articulating it so beautifully. I'm going to give Catherine and Michelle, each of you, sort of a final word as we're sort of wrapping up. Reflections or sort of thoughts that you want to sort of offer up as sort of final messages. Michelle, go ahead.
Yeah, well, one, I want to just thank Angela for being here to share her perspective and story. This is part of the joy of our work, is centering the work of those who are caring for families and hearing on the ground in their communities what is happening in communities. So thank you, Angela, and thank you to the providers who are out there continuing to do this important work in the context of this very challenging environment. And I appreciate all who have joined today, and encourage us all to find ways that we can ensure that we have educators at the table in the conversation and continue to lift up what we know is critical for our communities, and not just for young children and families, but for our communities, business, and our economy.
Michelle. Catherine.
No, yes, absolutely. Thank you for having me. I think that there's so much that's possible, and it's really hard in the day-to-day because the day-to-day is so hard sometimes, that we can look to the future and see a lot of possibilities before us. I know that myself and others have proposed basically New Mexico's version of the land grant, but to dedicate the estate tax to children, and to make a federal trust fund for early childhood and early childhood nutrition and education via the estate tax, kind of like a permanent fund, money coming in, it never runs out, and it's always there. I mean, there's all kinds of policy options on the table, and we have learned so much, all of us, not providers, parents, over the past few years, that there is a lot of possibility. And I think thinking in terms of what's possible instead of what we don't have is how I try to look to the future. And I would be remiss if I didn't say that I have had 2 children in childcare, and for the many childcare providers on the call, you make me possible.
I thank you. Those are wonderful final reflections. I feel the energy from all of the comments that came through, and what a brilliant way to start the new year with, let's dream big, let's continue to sort of work together. Thank you, sincere thanks to all 3 of our panelists. What a powerhouse, and just important messages for all of us to carry forward. Just a reminder that we will be gathering again February 6th, I believe. And this upcoming webinar is going to be on inclusion. So including all children, creating more inclusion in early childhood settings. Thank you all for your time and attention. And again, thank you, Michelle, Catherine, and Angela. Take good care, everyone.
Thank you.
Thank you.